cases of coronavirus continue to spike every single day here in Virginia. As health leaders urge everyone who is eligible to get vaccinated, we're hearing from VDH and they're saying the average number of COVID tests coming back positive now up to 17.5%. Yesterday we were at 16.
Tonight we have in-depth coverage. Our Melissa HIPOLIT explains in depth why the number of young unvaccinated children is so low and cases continue to rise.
But first, let's start with our Cameron Thompson, who spoke with a state health official about the spike. Cameron, New Year's Eve, Friday, how concerned are they?
Yeah, well, Leland, this is all coming on the news today that Virginia has set a new record for the number of cases reported in one day, over 12,000, breaking the previous record of just under 10,000. And when it comes to celebrating New Year's or any other gathering at this time, they're saying it depends on what you're doing and who you're gathering with. When deciding whether to go to a New Year's Eve party or other holiday gathering, Dr. Laura Murphy with the Virginia Department of Health says you can break it down into 3 risk categories: low, medium, and high.
I would generally recommend you avoid or think carefully about high-risk events and your participation in them.
Low-risk events include virtual ones or those just with members of your household. Medium risk includes indoor events with fully vaccinated people or outdoors if you don't know, while high risk includes indoor events with people with an unknown vaccine status or where people are close together cheering or celebrating loudly.
Really try to focus on those lower risk types of events. We'd also ask people to keep in mind that layering prevention strategies is always better than just relying on one.
Murphy says prevention strategies include things like masking, testing, and getting the vaccine or boosters. And while VDH is offering this guidance, some event organizers around Richmond have already decided to cancel their plans because of the current surge.
It's unfortunate all the way around. We had a wonderful program planned out.
The Alegba Folklore Society canceled its Kwanzaa celebration set for Friday and say they had precautions in place but changed their minds as the numbers kept rising.
If we just had that one incident, it would just put a damper on everything. And so that's when the risk became too great.
A similar story for Puppets Off Broad Street, which canceled its week-long RVA Winter Puppet Fest, adding they consider the ages of the event's primary audience.
Really that like age 3 to 11 space, some of whom could be vaccinated, they're not fully vaccinated, and many of whom can't be vaccinated. Given all the other cancellations that have been happening, it seems like that was the right decision to make.
Now, because of the short time frame in which they made their decisions, coming up at 6, how these groups have or hoping people are still able to celebrate with them. Working for you in Richmond, Cameron Thompson, CBS 6 News.
Okay, thanks so much, Cameron. And Governor Northam says more than 14 million shots have been administered across the Commonwealth. The governor is urging Virginians to remember that the data points to vaccinated people who contract the virus having less severe symptoms and unvaccinated people are having more severe symptoms. The governor says nearly everyone going to the hospital with coronavirus is unvaccinated. In a statement, Northam says, quote, "This is entirely avoidable if everyone gets their shots. People working in the hospitals are exhausted. They have worked tirelessly for months to care for people who have gotten sick. Please go to the hospital only if you believe you really need to." End quote. Well, Northam also says it's not fair to put even more pressure on hospital workers to care for people whose sickness is avoidable.
More than 67% of Virginians have gotten 2 shots so far, and nearly 2 million have gotten their booster shots. But many parents are still hesitant when it comes to vaccinating their children. Our Melissa HIPOLIT dug into Virginia's data to find out how many kids are actually vaccinated. She also spoke with parents about the reservations and to a doctor who says the shot is the best way to protect children. Melissa?
Well, Candace, vaccine uptake among children over the age of 11 is 3 times higher than it is for children between the ages of 5 and 11. Now, parents I talked to who have children in that age range told me they're just not sure how their small children would react to this vaccine, but a local pediatrician told me this is safe for kids. Vaccinated themselves.
I'm vaccinated myself, but I have no idea how it affects children.
but still unsure of whether to get their young kids ages 6 and 9 vaccinated.
The rest of the adults in our family, we've gotten vaccinated, but for him, it's just scary.
Even with COVID cases soaring in Central Virginia, moms Kayla Williams and Dawn Cross just aren't 100% comfortable with their young kids getting a COVID vaccine.
I was worried about how she would be able to handle it if there was going to be any side effects for her.
He has nonverbal autism, and we're just on the fence right now whether to get him vaccinated or not, especially with the side effects, especially even with the long-term side effects. Nobody knows anything.
The moms are not alone. Take a look at these numbers from the Virginia Department of Health. They show the percentage of children fully vaccinated in 3 different age groups. As you can see, the 5 to 11-year-olds have the lowest rate of vaccination by far, with just 21% fully vaccinated. Dr. Tiffany Kimbrough with the Children's Hospital of Richmond at VCU has some idea of why that might be.
Parents with young kids are hearing that kids are mostly doing well. So understanding the importance for vaccinating that age group has been one of the things that pediatricians like myself are really trying to hammer home.
Dr. Kimbrough says she understands parents' hesitations, but she believes the vaccine is safe for children ages 5 to 11.
And we've been now vaccinating millions of kids to date, and we aren't seeing large-scale issues. The myocarditis rate is really low in this age group, not even higher than what we would expect in general population, and we aren't seeing other issues for them.
She had her 6-year-old vaccinated, and she hopes other parents will do the same.
We do see kids mostly do well, but some kids don't, and we don't always have good predictors on who those children are. So healthy kids can end up in the hospital and with complications from COVID. And so it's still really important that we vaccinate this age group, and so that also will help us to reduce community spread as well.
Now, the pediatrician you heard from there said she's also hearing from parents who are concerned about their children's future fertility when it comes to the vaccine. Ahead at 6 o'clock, I'll explain why she says not to worry. Working for you tonight in Richmond, I'm Melissa HIPOLIT for CBS 6.
Thanks, Melissa. New at 5 here, VCU is now requiring booster shots. The university says everyone who's eligible for a booster must get one by February 1st. If you're not eligible until after that date, you must get one within 30 days of becoming eligible and report it to the school. All members of the VCU community are required to be vaccinated unless you have an approved medical or religious exemption. VCU plans to begin their spring semester on time Tuesday, January 18th. And we're also learning about booster guidelines at Virginia Tech and Virginia State. Those details still to come. And as cases continue to spike, so does the demand for COVID tests. Some neighbors showed up early this morning and waited for hours just for their chance to get one. Our Caroline Colburn speaks with a few of them ahead at 5:30. And remember, all of our COVID coverage is right in the palm of your hand whenever you need it in the free CBS 6 News app.